Zolo Sapeta is the General Secretary of the Nursing Union, NEHAWU. Zolo, good afternoon to you. I'm hoping that you heard part of that interview. The chair of the South African Medical Association talking about how difficult it is for doctors, the frustration, the lack of resources, literally the life and death decisions that have to be made in the most intensely stressful situations. Your nurses, your members are stuck in the middle of this as well.
Good afternoon to you and the viewers. Yes, I can confirm, because you'll remember that 3 weeks ago I was in Eastern Cape, and from today the president is in KZN, and the rest of the other national office bearers, they will be deployed in different provinces in Western Cape, Eastern Cape again, and here in Gauteng. And the report that we're getting is that really the situation and the environment is not conducive for our members and frontline workers to do their generally crisis.
You talk about a crisis. Is it dangerous for your members? I mean, many of your members, it seems, are contracting the disease. Nurses and doctors are actually in danger of catching COVID-19 despite all the precautions.
Correctly so. As of 16 June, 199 doctors alone in the public sector and 43 doctors in private sector were tested COVID-19 positive, and 1,684 nurses in the public health and 214 nurses in private health. I'm just talking about those who met us in the hospital. But in total, 3,479 health frontline workers who tested COVID-19 positive as we speak, as of 16 June. We are not sure what will be numbers from the 17th up to date. My team here at the office is analyzing that, and with different categories of frontline workers at the hospital. And we're just reflecting only in health, not necessarily to other sectors we were organizing. And we are worried that those people who are to save lives of the nation are the ones that are positive, and we wonder how would the nation be saved, the life of the nation will be saved if this is a situation. And we have been raising these matters as far as March. The department, unfortunately, all our efforts have reached people who are not prepared even to listen, particularly the Minister of Health.
Can I ask, I mean, there's supposed to be protocols in place. I realize that in hospitals, I mean, very high germ environments, there are protocols that are supposed to be followed to protect people. Are they not being followed?
I personally experienced a situation in Newzroom Provincial Hospital 2 weeks ago. I entered into the hospital, past two main entrances, without being screened, without being sanitized myself. And I had raised the matter to a point that I'm told that the acting CEO at the time had resigned, and the president was just briefing me because he was at Stenger Hospital this morning, and the CEO ran away with the president. So these are the kind of managers, and these are the kind of situations that were subjected. You would imagine if a hospital has no thermometer to screen people coming in and is not sanitizing people, what will happen? And I was able to move from ward by ward from this point to that point without really being looked into.
It's just incredible. I mean, your members must actually be scared to go to work, and yet they're absolutely critical to go to work because we need them to treat patients.
That's a reality. Our members are caught up in between the rock and the hard place, because if they are complaining, they are subjected to dismissals, and if they are complying, they get vulnerable to this disease. That's a situation that we are in now, and we have asked the leadership to be on the ground, and if everything is not changing from this point, we'll be left with no option but to be where our members are and make a choice in terms of how we defend our members, because we can't sacrifice our members in a quest to save the nation. We must put measures to save their lives in order to be in the position to save the lives of the nation.
Okay, so what do we need to do then? Do we need more money? I mean, the Health Minister has said that there's enough PPEs. The head of the Eastern Cape Health Department, you referred to the Eastern Cape, we understand there are problems there. The head of the Eastern Cape Health Department said yesterday that they actually did have capacity for more patients. They were on top of the situation. From what you described, there seem to be difficulties there. So what solutions are there? Do we need more money, more resources, more PPEs, more care? I would imagine more counselling.
That's that here. It's not true that we have adequate PPEs. That's why I contributed 695 and also the face shield by 600 in one hospital, Livingston. The president today was contributing that in the Stenger Hospital. And the first deputy president will be visiting hospitals in Western Cape, contributing, even here in Gauteng and Eastern Cape. So we wonder where are these adequate PPEs if so much frontline workers will be infected? Because one of the critical reasons why we are calling for government to put this is precisely because people are forced to work without PPEs. As a result, they get positive. We want them to bring these PPEs that are enough because we're on the ground ourselves.
All right, it's an incredible situation, Zola. I mean, you represent people who are on the front lines. I mean, are you talking to government about this? Please tell me that there's some kind of conversation happening.
We've given up at the national level, despite the fact that you'll recall that we have been making a call since March. We even attempted to go to court. Eventually, we met the minister on the 8th April, and we had agreed. Since then, we have never met him. We've been trying to meet him, and we have given up. We're no longer even attempting to meet with him. That's why we have taken a conscious decision to go where it matters the most. But we will come back. We will come back. It will, and unfortunately, by the time you want to talk to us, we won't be ready for him to talk because there's no time to talk. We must be on the ground. We must save lives. We must prepare the battlefield. And the reality is that the battlefield are hospital.
All right, Zola, I mean, a very difficult situation for you, difficult situation for your members. You talk about the conversations that you're having with the health department. Doesn't seem like you're having much luck there. I mean, what then is your prognosis for the future? We're just going into the storm, as the health minister himself calls. We're going into the storm without the correct boat. We're going to, I mean, if we're not careful, we're going to drown.
That's the reality of the situation. We have soldiers in the battlefield with machine guns, but there's nothing inside the machine guns. We need bullets to put in the machine guns so that we face the enemy, because the enemy has all what it takes to defeat us. And secondly, we have created a kind of a doom kind of a society, because we speak more about the infection, about the deaths, but we less about the recoveries. And we suggest that we must speak about recovery, not recklessly, but as a form of giving hope, not only to the nation, but also to the soldiers. There is no competition. For instance, about 20 billion out of the 500 billion that has been set aside to True Solidarity Fund that is directed to the health. What happened to 480 billion? If this matter is a health matter, it must be fought in the battlefield, which are the hospitals. And we hear the minister talking about the shortage and the reinforcement of beds and the infrastructure that they are trying to do. But they will not do anything with this 20 billion if the 400 billion is elsewhere. And out of this 480 billion, there is no percentage, set aside to encourage and compensate our soldiers who are working without necessary instruments. As I was saying, we have just machine guns without bullets, but we are taking the risk.